Well, welcome everyone. My name is Marti R. Dubose, and along with Dr. Daniel Ganu, it is my pleasure to be back for day 2 of the Lifestyle Management's Day 2 Symposium. So Dr. Ganu is the founder of the nonprofit Lifestyle Management Center in Ghana, and it is also scheduled to speak today about his miraculous health recovery, which led him to launch the Lifestyle Management Center in Ghana, Africa. So this symposium serves as his inaugural event to increase the awareness of nutritional healing in Ghana and across the African continents. Now we have 2 speakers scheduled for today, and immediately following each speaker, we'll begin a Q&A session to address any questions you may have. So please click on the Q&A tab at the top to submit your questions, and Tamika, our TAC admin, will assist in helping to get those questions answered by the speaker. Now, we do also have a chat button so that you can chat with each other, because I know we have a lot of people across the continents. So feel free to chat there, but put your Q&A in the Q&A session. Also, you don't have to worry about taking notes during the session, because we'll send you, each person who has registered, links to the recording of each day's sessions, because we really want to ensure that you have the opportunity to stay focused on each speaker's life-changing message. Now, like I said, we do have attendees from countries in Africa, along with the countries of North America, which is good to see, because the growing number of people affected by diabetes, which is our next topic, is growing at an alarming rate on both continents. As a matter of fact, the World Health Organization and the International Diabetes Federation estimates that the diabetes population will double over the next 25 years in Africa alone. And there are many more that are pre-diabetic. And with 1.2 billion people in Africa, it is time to start paying attention and understanding the root cause so that we can prevent and even reverse the horrific effects of diabetes. So these 2 speakers today, if you can stay, you won't be disappointed. Now, the first speaker, Dr. Neal Barnard, will speak on reversing diabetes through nutritionally healing foods. Dr. Neal Barnard is both the founder and president of the Physicians Committee for Responsible Medicine, PCRM. He's also an adjunct professor of medicine at the George Washington University School of Medicine in DC. He's authored over 100 scientific publications and 20 books. Now, one in particular is Dr. Barnard's program for reversing diabetes, the scientifically proven system for reversing diabetes without drugs, which is a book I have and I highly recommend it. Dr. Barnard has led numerous research studies investigating the effects of diet on diabetes, body weight, hormonal symptoms, and chronic pain, including a groundbreaking study of dietary interventions in type 2 diabetes funded by the National Institute of Health that paved the way for viewing type 2 diabetes as a potentially reversible condition for many patients. Now, many of you have seen him on national media, YouTube, and other sources. So it is my pleasure to introduce Dr. Neal Barnard.
Well, thank you so much, Marti, for that kind introduction. And I want to say a huge thank you to Dr. Daniel Ganu thank you for your leadership. Thank you for including me in this very, very important program. If I may share my screen, I would like to talk with you about the origins of our work on diabetes and to really discuss how this began with the research of other individuals in other medical centers. First of all, let me just share my disclosures. I'm on the faculty at George Washington University, and I serve without compensation as the head of the Physicians Committee and the Barnard Medical Center, and I give lectures and write books. What I'd like to start with for just a couple of minutes is not diabetes, but cardiovascular disease, because this is where our attention first started, and that led us to looking at diabetes more closely. If you look at the top of your screen, you see a healthy, wide open artery. Those red blood cells are carrying oxygen to the heart and throughout the body. Everything is great. In the middle image, you see something that's not so great. And in the artery wall is what looks like a blister. That's an atherosclerotic plaque. And as particles of cholesterol irritate the artery wall, they form blisters like this throughout the arterial system. In the bottom image, what you see is that blister, that atherosclerotic plaque, has ruptured. It's broken open. When that happens, you have a clot forming in place that's just like a cork in a bottle. The blood flow stops. So in the top image, there's blood flow that's wide open. In the second image, you see blood flow is closed off a little bit. In the bottom image, the blood flow has stopped completely, and that becomes a myocardial infarction, a heart attack. That's the final event for a great many people, unfortunately. And back 30 years ago, Dr. Dean Ornish in California asked a very provocative question. Is it possible not just to prevent heart disease, but could we perhaps reverse it? He wanted to see if that ugly-looking artery at the bottom could look like a healthy artery at the top. And he didn't do this with surgery or with medication. He did 4 things as part of an experimental program. First of all, vegetarian foods. He asked people with heart disease to avoid animal products for the most part. Now, you might ask, why would you use vegetarian foods for heart patients? Well, why would one do that? Okay, avoiding cholesterol. Cholesterol is only in animal products, and avoiding the bad fats. Okay, fair enough, that makes sense. Secondly, a half-hour walk every day. Third, reduce stress, which is why he did not do the study here in Washington, D.C., where I live. And finally, to avoid tobacco. And you'll notice he didn't use medicines. He didn't use surgical procedures, just these very simple lifestyle changes. And after a year, the results were dramatic. Total cholesterol dropped by 24%, and bad cholesterol, LDL cholesterol, dropped by 37%. That's the kind of result you might expect from a statin drug. This was done with beans and grains and vegetables and fruits. Now, the average person lost about 10 kilograms over the first year. That's 22 pounds. That was impressive. But what made headlines everywhere was the angiographic findings. Everyone had an angiogram of their coronary arteries at the beginning of the study and again 12 months later. And you could see signs that the disease was reversing. The arteries were opening up again in 82% of the participants without drugs or surgery. Let me share with you an angiogram that shows what this looks like. This is an angiogram of a surgeon. That's right. This was a surgeon at the Cleveland Clinic, and this is the left anterior descending artery. And as you can see, instead of it being a nice, big, curving artery, it's crinkly and narrowed and diseased. And in that portion that's marked with a bracket, that's a long section of a diseased artery, too long to be treated with a stent. And this surgeon, the surgeon was the patient, he could not tolerate statin drugs. He had no choice. He had to change his lifestyle to save his life. And what he did is he went on a low-fat vegan diet. Now, when I say a vegan diet, I don't mean a person from the planet Vegas. I simply mean a person who avoids animal products. And he kept fats very low too. And on the right-hand side of this slide, you see the result 32 months later. Now, if the pictures, the little photo strip is getting in the way of the image I'm trying to show you, just minimize that the photo strip or drag it out of the way, because I want you to see this artery. As you can see, the artery has effectively healed. Now, that was news, because we know that you can cut yourself and the cut will heal, or you can break a bone and the bone will heal. But can an artery heal? And the answer is no, it won't heal as long as we keep spraying particles of cholesterol up and down our arteries. In the same way as if you keep picking at a cut or hammering on your broken leg, they will never heal. But as soon as you get out of the body's way and allow the cholesterol to be taken out of your diet and reduce the amount of cholesterol in your blood, the healing can begin. And that's what we've seen here. Now, let's look at different animal products. As you can see, the middle column is cholesterol. Animal products have a substantial amount of cholesterol, don't they? Whether it's beef, chicken, not any better with regard to cholesterol, salmon, cheddar cheese, eggs, they all have cholesterol. But what's perhaps even more important is the saturated fat. That's the right-hand column. As you can see, animal products have a substantial amount of saturated fat. But when Dr. Ornish picked plant foods, well, these numbers show you why. Look at that. No cholesterol, almost no saturated fat. There's a day and night difference between the disease-causing foods and the ones that heal. Now, let me draw your attention to Chinook salmon. Here in Washington, D.C., where I live, there's a bit of a myth that I can eat meat if it comes from a fish, as long as I avoid meat that comes from a bird or comes from a cow. And so many people are eating salmon thinking, well, this is going to reverse my heart disease or help me to be healthy. But unfortunately, as you can see, look at those numbers. It's got cholesterol, it's got saturated fat. It's a lot more like beef than it is like broccoli. The plant foods are the ones that bring healing. Okay, so my research team was inspired by this. And we first did a study in people who were overweight who did not have diabetes. 64 overweight women, and they were randomly assigned to either a vegan diet or a conventional diet. And we asked them not to exercise only because we wanted to focus on what diet alone could do. Let me describe the diets. The plant-based diet relied on fruits and grains and legumes and vegetables. Legumes is just a word for beans or pulses, so to speak. And when people were shown the kinds of foods they could eat, they were a bit afraid because it seemed indulgent. On a vegan diet, I can eat blueberry pancakes with syrup, or I can have oatmeal with cinnamon and raisins. I can have fruit without worrying. I can have my toast with jam, but, well, no butter. As you can see, we left out the animal products. There's no bacon or sausage or roast beef or pork. Lunch could be a vegetable chili, and they were free to eat all kinds of beans, vegetables, fruits, grains, and all the foods that they turn into. Some of our participants discovered that some candies were vegan. Now, we don't recommend them, but they actually weren't forbidden in this study. I'm not recommending them now either, but our participants might have had a little bit of that perhaps. Nonetheless, what we saw is over 14 weeks of study, the people on the vegan diet lost substantially more weight, 5.8 kilograms, compared to 3.8 kilograms on the control diet, the portion control diet. Now, what's more important, though, is not short-term weight loss. What's more important is over the long run, the participants continued to lose weight. They were slimmer after 2 years than they were at the beginning of the study. The people on the conventional diet, though, didn't have that benefit. They put all the lost weight back on. Okay, so as Marty mentioned in the introduction, back in 2003, the National Institutes of Health gave us a research grant to try to see what would happen for people with type 2 diabetes. We brought in people who had diabetes, and half of them went on a plant-based diet. The other half went on a portion-controlled diet. Let me describe both. A portion-controlled diet is what you'd think of as a conventional diabetes diet. Cut calories to try to lose weight. Now, many diets also say limit carbohydrate and limit bad fats like saturated fat. That was the conventional advice. The experimental diet, the one we were really testing, was plant-based, and that meant no animal products, vegan, minimize oils, and favor low glycemic index foods. Let me make clear what that is. If you eat some white bread, that's going to cause your blood sugar to rise rather rapidly. But if you change to rye bread or pumpernickel bread or beans, even though they have carbohydrate, they digest much more slowly and release their natural sugars more gradually. So this was not a low carbohydrate diet. People were free to eat as much carbohydrate as they wanted, but we favored the low glycemic index carbohydrates. That means fruit, beans, and other legumes like lentils, and many foods, but not so much, say, the refined grains. Okay, to cut to the chase, what we look at here is the drop in hemoglobin A1C. As you know, when a person has diabetes, we're trying to get it below 7. But our people started out at about 8. And following the control diet, that's the red line, they improved. Their A1C dropped by about 0.4 absolute percentage points, which is a good change. But the people in the vegan diet, the plant-based diet, improved their A1C by 3 times better. They dropped their A1C by 1.2 absolute percentage points, or even a little bit more. Okay, let me share with you one participant in this study whose experience really changed our course and our expectations for what diabetes could do. He was 35. He had had diabetes for 4 years, and he was treated with metformin. Now, he didn't just have diabetes. He also had weight he wanted to lose. His cholesterol level was high. He was taking a statin for his dyslipidemia, and he had erectile dysfunction. And when I asked about his family, he said, I've got diabetes in my family. My grandmother, my grandfather had diabetes. And I remember him saying, if I don't get this under better control, I'm going to lose a leg or I'm going to go blind. So he was motivated to change. So at the beginning of the study, he weighed 276 pounds and his A1C was not in the right place. It was 9.5%. Now, his total cholesterol was high too at 221, and his LDL was 146. He had symptomatic erectile dysfunction. So the treatment we gave him was simply avoid animal products, oils, so this is not a greasy diet, and finally to favor the low glycemic index foods, right? So just 3 simple things. Vegan diet, keep oils really low, favor low GI foods. Now, 3 months later, where was he? Well, his weight went down to 251, so that's 25 pounds drop. That's good. About 10 kilos, a little bit more. His A1C had dropped from 9.5 to 7.1. That's a huge improvement. That's better than you're going to see with any oral medication. His total cholesterol and LDL, we didn't check in 3 months, but his erectile dysfunction had already gone away. That all got his attention. So at 14 months, he was now down about almost 60 pounds. His A1C was 5.3. He was off his medications. His total and LDL cholesterol had improved, and his erectile dysfunction remained in remission. Now, let me draw your attention to this A1C. He started out at 9.5. He's had a drop to 5.3. And let me ask you, 5.3, does he have diabetes? Does he have prediabetes? Does he have anything? Well, 5.3 is a healthy A1C, and that man could walk into any clinic in the world. And with an A1C of 5.3, he would not be diagnosed as having diabetes. Now, when we got this result, this was a bit of a shock, I must say, because I was taught something you may have been taught too. In medical school, I was taught that diabetes is permanent. Once you have diabetes, you'll always have diabetes, is what we said. Now, this was not intended as something negative. It was intended to encourage patients to realize that diabetes is dangerous and to take it seriously. Once you have diabetes, you'll always have diabetes. You have to check your blood sugars. You have to take your medications carefully, except that here was a man who didn't have diabetes anymore. So from what we could see, his blood test was totally normal. Okay, we now believe that diabetes is reversible, that a person may have diabetes now, but it's not a trait that you have forever. It is a state that you can change. Don't misunderstand me. Cheese, meat, greasy foods, they're waiting around the corner. So if a person had diabetes before and they got rid of it, if they eat bad foods again, that diabetes can come back. The idea is to see what we can do to improve it as much as possible, to cure it if we can, and to prevent it from ever coming back. Now, let me have your very close attention right now. If you're emailing somebody or texting, let me ask you to have your full attention because I want to explain to you the cause of type 2 diabetes. This big purple oval is a cell. a cell in the body. This could be a muscle cell, for example, or maybe a liver cell. And cells run on a certain fuel. That fuel is glucose. You know about this. There's glucose in the blood, and that glucose has to get into the cell. That glucose is going to fuel the cell. It powers it like gasoline can power a car. The glucose powers the cell, but it needs to get inside, and you'll see it can't. Glucose does not pass through that cell membrane. There are channels to let it through, but they're not open. So I need a key. The key is insulin, and that insulin key will attach to the surface of the cell. And when it does, it opens up a little channel that lets the glucose come inside. Okay, make sense? Now, what could ever go wrong? Well, what could go wrong is this. I'm eating meat for dinner, for lunch, for breakfast. I'm eating a lot of oily foods, fatty foods throughout the day. And yes, there's fat in all of these foods. Now, what could fat have to do with diabetes? Here's what it has to do with the diabetes. This cell starts to incorporate the fats from my diet. As I'm eating meat, or I'm eating cheese, or fried foods, the fat that you eat goes and passes into your muscle cells. These are tiny particles of fat. You can't see them with the naked eye, but they're building up inside the cell. And doctors hate words like fat because it only has one syllable. So doctors call it intramyocellular lipid. Intra means inside. Myo means muscle. Cellular means cellular. Lipid means fat. Intramyocellular lipid is fat buildup inside the cell, and that came from the foods that you eat. So what's that fat going to do? Well, now the insulin key attaches to the cell, just like normal, but you discover that the key doesn't work anymore. Those glucose molecules can't get through the membrane. Something about fat building up inside the cells causes insulin resistance. Insulin resistance is the first step toward type 2 diabetes, and it comes from the fat that we ate. So now I'm going to go on a vegan diet. No animal products. I'm going to keep oils low. And I discover something. The fat starts to go away. I'm avoiding fat in my foods, and the fat comes out of my cells. And as the fat goes out of my cells, my insulin resistance goes away, and I'm now more insulin sensitive. And so the glucose can go back into the cell. My blood glucose goes down, and my blood numbers are getting better and better and better. And suddenly my doctor is smiling, saying, whatever I'm doing, my diabetes is improving. Okay. Let me go back in time. I want to share with you some of the early results that led to this totally new understanding of diabetes. Back at Yale University, researchers wanted to see what fat would do for insulin sensitivity. They brought in volunteers, and they were healthy, young, with a normal weight, but they put an intravenous line in each one. And they put in a lipid infusion. What I'm saying is they put fat into their bodies through their veins. And as they did that, they measured their insulin sensitivity. How well were their muscles responding to insulin? And what they showed is that as time went on, after the lipid infusion, their insulin sensitivity started to fall. Their insulin resistance was getting worse and worse and worse. But what we discovered because of this research is that insulin resistance is not something that you need to take 2 years, 5 years, 10 years to develop. You can develop it in just a few hours as fat comes into your body. Now, that's a fat infusion. What about diet? Well, researchers in Germany wanted to see if we give one meal that's high in palm oil, what will that do with insulin sensitivity? They brought in individuals, gave them a lot of palm oil, but in just one meal. And what they showed is that, yes, their insulin sensitivity fell not from a lipid infusion intravenously, but from one fatty meal. What if I use a healthier oil, like canola oil, sometimes called rapeseed oil? Yeah, exactly the same result happens there too, that when I'm eating this oil, The fat particles get into my muscle cells and insulin cannot work anymore. Insulin cannot work in an oil slick. This is a completely new way of viewing diabetes, isn't it? So many people thought diabetes comes from eating sugar or from eating carbohydrate, eating bread or potatoes. It comes from fat building up in cells, muscle cells and liver cells, causing insulin to not work anymore. And if we can get the fat out of the cells, we can improve our diabetes and maybe get rid of it. Okay, now let's go back to Yale University. Yale University brought in 26 healthy people. They were young. Everybody got a glucose tolerance test, and you know what I'm talking about. You drink 75 grams of glucose, and then you see if your blood sugar goes up and comes back down, or if it goes up and stays up. Now, for some of these people, they were insulin sensitive. They drank the sugar, their blood sugar went up, but their insulin responded and then brought the sugar back down. It brought the sugar into their cells. They were insulin sensitive people, but others were insulin resistant. So when they took the glucose syrup, their blood sugar went up, but it stayed up because their insulin could not get the glucose into their cells rapidly. Okay, well, let's look at who are these people. Well, first of all, they're young. They're in their late 20s. Secondly, they're not heavy. They're thin. 60 kilograms, 64 kilograms. These are not heavy people. And finally, do they have diabetes? No. Their A1Cs are in a normal, healthy range. But now, let's look inside their body. Let's go into an MR scanner, magnetic resonance spectroscopy. Using magnetic resonance spectroscopy, we can look inside their muscle cells and their liver cells, and we can see the fat that's there. Okay, on the left of this slide, you see the intramyocellular lipid, the fat inside the muscle cells of each of these individuals. Every dot here is a person. And if you compare the insulin-sensitive subjects on the left to the insulin-resistant subjects on the right, you can see that the insulin-sensitive subjects generally have very little intramyocellular lipid. The ones who are insulin-resistant have much more. Now, on the right-hand half of this slide, we're looking at mitochondria. You know the mitochondria. Those are the burners, the microscopic burners inside your cells, the ones that allow your body to use energy. This is the mitochondrial activity for the insulin-sensitive subjects, and this is for the insulin-resistant subjects. What I mean is this. These are young, thin, healthy people who do not have diabetes. But some of them are already insulin resistant, which we just found out because we tested them with the glucose tolerance test. And what we see is they have fat building up inside their cells. It's shutting down their mitochondria. It's stopping them from being able to use glucose. And they don't have diabetes now. And they won't have diabetes for another 15 years or 20 years. But the process has started now. How many people do you know who are eating fatty foods? How many people do you know who are starting to gain weight? How many people do you know who are at risk for diabetes? Well, we now know what's happening in their bodies, and this gives us the key for reversing it. I would like to talk to you about a study that we did at a car insurance company. For about 3 or 4 blocks from my office is the home office of Geico, the government employees insurance company. And they heard about our diabetes research, and we decided to do a research study, not here in my laboratory, but at work, to see how this would go for just anybody who wanted to see about changing their diet. And we invited people who had diabetes or who were overweight to join our study. And what we asked them to do was to go vegan, and to do this for a number of weeks and see how they did while they were staying at work. So once in a week, they would come over to a class that we gave them. We showed them how to go vegan, and we asked the cafeteria manager to make sure that he had healthy plant-based foods in the lunch line. Now, I'm sorry to tell you that this was a bit of a new thing for the cafeteria manager. A vegan burger, that's good, but oh, wait a minute. Topping the burger with bacon and cheese? I don't think so. So anyway, they fixed that. And we had great success with this study. So we ended up doing it in 10 different cities all around the United States: Buffalo, New York, Fredericksburg, Virginia, Virginia Beach, Macon, Georgia, Lakeland, Florida, San Diego, California, to see what would happen if we looked at people in the North, in the South, in the East, in the West. How would it go? And what we found is that there is no barrier. People can do a healthy plant-based diet wherever they may be. And if we looked at body weight, the control group that did not change their diet, they didn't lose any weight. But the people who went on the healthy diet, the people in the intervention group, those who avoided animal products and kept oils low, well, they started losing weight very well. And when we looked at hemoglobin A1C, exactly what you would expect to happen is what did indeed happen. The control group didn't improve, but the people changing their diet to a healthy vegan diet, their A1C got healthier and healthier and healthier. Okay, so we also looked at mood. This may surprise you. As people were going along in the Geico study, we noticed that their depression, if they had depression, it was getting better. In the vegan group, their depression started to diminish. And the same thing was true with anxiety. What we saw was that psychological symptoms improved dramatically. Okay. Now, we are not the only ones to have looked at this. Other researchers have looked at vegan diets as well. And this forest plot will show the results of all of them. If that, each line here is a research study. There are 5 studies. And if that little black box is to the left of the center line, that means that A1C got better. And as you can see, in every one of these studies, the line got better. A1C improves. Plant-based diets are good for diabetes. The next question is, what if I've had diabetes for a long time? What if I'm starting to get nerve damage or other kinds of complications? We all know that most people with diabetes don't die of a high blood sugar. It's the complications that affect them, to their kidneys, to their nerves, and especially to their heart. So we brought in individuals who had neuropathy, the painful nerve condition that comes as a diabetes symptom, 34 of them. And what we did is we asked them to begin the same dietary intervention that's familiar to you now. And no animal products, minimizing oils, and low glycemic index foods. And then we asked people, how do you feel as time goes by? Do you feel no different, no change, almost the same, or are you a lot better? And what we found is that the people on the vegan diet, they rated themselves at about 5. In other words, they were moderately better after this rather short study. The people in the control group, really not so much. But then we wanted to see objectively, are you better? And we used galvanic skin response. The participant will put their hands on a metal plate and their feet on a metal plate. And what we're measuring is their galvanic skin response, which is a measure of the fine nerves, the function of the fine nerves in their hands and their feet. And what we showed is that in the control group, which is tan, it continued to worsen, but in the experimental group, it got slightly better during that time. In other words, this progressive complication of diabetes that we call neuropathy was actually getting better, and symptoms were improving as well. If you know anybody who has neuropathy or you have it yourself, you know the medications are not very good. But we now know that a healthy diet can help with neuropathy as well for many people. Okay. So now let me go back to where we started. Many people imagine that type 2 diabetes is caused by sugar. For example, sodas. And you can understand why a person would think that, because diabetes means my blood sugar is going up. And if I have a soda or anything that has sugar in it, that makes my blood sugar go even higher. So in the BMJ, the British Medical Journal, a meta-analysis was published in 2015. And they showed that people who had the most sugar-sweetened sodas had an 18% higher risk of developing diabetes. And even if I control for adiposity, for body fatness, we still see an increased risk of diabetes with people drinking more soda. Now that seems to suggest that the soda might cause it. Oh, but wait a minute. The researchers looked at something else too. They looked at sodas that were artificially sweetened, that didn't have sugar in them. And they found that they were associated with higher risk of diabetes too. And if I adjust for adiposity, we still see it. Wait a minute. It's not necessarily sugar, it's something about the soda. If the sugar, if the sodas cause it, whether there's sugar in it or not. Wait a minute. 2 years later, researchers did a new study. This was 2017, and in the Canadian Medical Association Journal, they reported their results. And what they found is that if you look not just at soda, but sugars of any kind, you see that the more sugar people eat from fruit, from other foods, actually diabetes risk went down by about 9%. For fructose, marginally up 4%. For sucrose, down by 11%. Wait a minute. It doesn't seem that sugars are driving the diabetes here. Okay, what's the issue? If sodas seem to cause it, whether there's sugar in the soda or not, what we're learning is that it may not be the sugar. Sodas are served with cheeseburgers. You know what I mean. When people eat an unhealthy soda, they're eating a lot of other unhealthy things right along with it. If you look at that meal on the left, a person might say, isn't that terrible? They're having a soda with that meal. I would agree. But everything else there is terrible too. They're having a burger smothered with cheese. That cheese is 70% fat. And what happens to fat that goes into your muscle cells? It causes insulin resistance. Those French fries have oil packed into them from the fryer. And where does that oil end up? Inside your muscle cells, causing insulin resistance. On the right-hand side, a person might say, what an unhealthy meal. Look at that Pepsi they're drinking. Well, that's not health food, but there's nothing healthy on this picture. There's fried chicken. Even without being fried, chicken breast is 23% fat as a percentage of calories. And where does that chicken fat go? Inside my muscle cells, causing insulin resistance. You would be healthier if you ate the carton and threw away the meat. So now there are healthy foods. Vegan foods can be quite varied, made from fruits and vegetables, grains and beans, and all the things that they can turn into. These are healthful foods. So what is a healthy diet? A healthy diet for losing weight, reversing heart disease, improving cholesterol, or tackling diabetes is a healthy plant-based diet. And that means really four foods, as we've discussed. Fruits, grains, vegetables, and legumes. And you need also to take vitamin B12. You need vitamin B12 for healthy nerves and healthy blood. And it's not made by animals or plants. It's really made by bacteria. Bacteria construct vitamin B12. And animal products have some B12 in them because in the cow's gut, the bacteria will make it. And so the B12 ends up in their meat or their milk. Now, unfortunately, along with that, you're getting cholesterol and a lot of fat. So what we encourage people to do is instead to supplement with vitamin B12. Now, here in the United States, there are a number of foods that are fortified with it, some breakfast cereals, and a lot of other things, but that's not necessarily a reliable source. So we encourage everyone to supplement, to take a vitamin B12 supplement. You don't need much, 2.4 micrograms per day. Okay. So this is a diet that's healthy at every stage of life. It's healthy during pregnancy. It's healthy for growing children. They'll get healthy protein. They'll get vitamins. In fact, their diet is healthier than if they were a meat eater. But you can explain this to other people. And what you'll discover is that a lot of people won't be listening to this. And that's because when you look at what is it that drives human decision-making, logic plays almost no role in human decision-making. I'm sorry to tell you. You know this is true. When a person starts thinking about what will I have for breakfast today, they don't think logically. They don't think, well, I could use maybe some fiber, some healthy complex carbohydrates. I should avoid that fat so it doesn't get into my muscles and cause insulin resistance. No, they don't think that. They're affected by noise. When I say noise, I mean the media, advertisements, or they're affected what their parents ate or what their friends ate, or maybe they're thinking about things they're kind of addicted to, or they're thinking about the cost of things or whatever, but it's not usually logic. And if you are a physician and you're explaining a healthy diet to a patient, let me show you neurologically what happens. Or you might be explaining a healthy diet to a friend. You're going to say a plant-based diet is very powerful. It doesn't have cholesterol. So it can help lower your cholesterol. It can help you lose weight. It can improve your diabetes. And when you say this is neurologically what occurs. The ideatron, do you remember that from your neurology? The ideatron causes an idea to form in your brain. And that idea, unfortunately, irritates the famiglia. And the famiglia then communicates to the don't-do-atory gland to release endorphins. All right, I'm kidding you, of course, but it's very much as if when you explain to people about a healthy diet, they think for a minute that could be a good idea, but then the idea is instantly shut down by the fact that their family and their culture has told them for a long time, you should eat meat, you should eat cheese, you should eat these things, despite the fact that they cause disease. We now know better. And we don't rely on logic to help people to change. Let me say that again. We don't rely on logic. We rely on a certain series of experiences. And if you're working with patients or if you're changing your own diet, here's how we do it. We break it into a couple of steps. We first explain to the individual how a healthy diet works. If you have diabetes, I'm going to take a piece of paper and draw an oval, and I'm going to show how the fat builds up inside your cell, causing insulin resistance. Easy to understand. You ready? Let's begin. So now step one is we're going to take 1 week. We're going to check out the possibilities. We're not going to change our diet. All we're going to do is we're going to take 7 days and we're going to see what we would eat if we were eating healthful foods. Okay, we're not getting rid of anything. We're just bringing things in to see what we might like. So we take a piece of paper and make a list. Breakfast, lunch, dinner, snack. What could I eat? Well, let's see. I could have oatmeal porridge, but to make it taste good, I could add some cinnamon or some raisins or some sliced bananas or some strawberries. Okay, now I'm getting somewhere. I could have pancakes. If I leave off the butter, I could add syrup and maybe some blueberries. Now we're talking. I could have my cereal with, no, not cow's milk, but with almond milk or soy milk or rice milk or whatever I want. Now, on the market, we see veggie sausages or tofu scrambler. Our idea now is to take a week and just try out these things. We're not going vegan yet, but we're trying out the vegan foods to see which ones we like. And you'll discover there are options for lunch and dinner as well. I could have a pizza without cheese. I could have a vegetable chili, a vegetable curry. There are many, many choices. I could have a bean burrito or a veggie burger or a stir fry made from plants. Easy. All right. And let's say I want to go eat at a restaurant. Here in Washington, D.C., there's an Italian restaurant about 2 doors down, and they have salads, they have soups, they have pasta, and sometimes they'll top the pasta with the meat sauce. But if I avoid that and have instead a vegetable sauce, they might call it a arrabbiata sauce or a marinara sauce. It's tomatoes and spices, but there's no animal products, so there's no cholesterol, no animal fat. That's a healthy choice. And if I go further down the street, there's a Latin American restaurant, and they have veggie fajitas and bean burritos and beans and rice. Skip the cheese, and you got a healthy dinner. Or across the street, there's a Chinese restaurant, and they have rice and vegetables and tofu dishes. And if I've never tasted tofu, now's the chance to give it a try. And if I go further down, there's a sushi bar with Japanese foods, and I'm not going to have fish sushi. I'll have vegetable sushi made from cucumbers, or an asparagus roll, or a sweet potato roll. And then down the block, there's an Ethiopian restaurant where there are many dishes that are wonderful treasures made from lentils and split peas and chickpeas and potatoes. Okay, well, you got the idea. Even fast food chains, no Taco Bell and Subway, that's not the pinnacle of culinary art, but even they can make me a bean burrito, hold the cheese, or a veggie sandwich. Okay, so by now, a week has gone by. I'm doing step one, I'm checking out the possibilities, and I found there are a lot of possibilities. There are things I can make at home. There are things I can eat out at restaurants, even fast food. So I've got quite a list. Good. Now it's week 2. The next step is to take a 3-week test drive. I'm going to go vegan, and I'm going to do it without fail, completely, every meal, for 3 weeks. Now, why am I doing this? Because I want to see how the diet will work for me. And you could do anything for 3 weeks, and you've already got your list, so it's easy, but I'm not going to cheat for 3 weeks. And that's because if I do this really carefully, every meal, a plant-based meal for 3 weeks, 2 things will happen. The first is physically, my body will change. I'm going to lose weight, even though I'm not restricting calories. My blood sugars are going to start to come down, even though I'm not restricting carbohydrate. My energy will be better. My digestion is better. My joints are going to will feel better. My mood might feel a little bit better. But the other thing that happens is, apart from these physical benefits, I haven't had any chicken wings for 3 weeks. I haven't had meat. I haven't had cheese in 3 weeks. And my tastes are starting to change as a result. That's right. Because I haven't had these things, I find I don't want them anymore. And that gives you power going forward. Let me share with you some other resources that you might want to put to work. Our 21-day vegan kickstart app is a free download. It's on your iPhone or your Android. Go to 21-day vegan kickstart, download it for free. And if you're a doctor, you can use it with your patient. If you're an individual with diabetes or any health issue, you can use it for yourself. It's in English, also in Spanish. We also have our nutrition guide for clinicians. This is also free. If you go online and just put in nutrition guide for clinicians, you'll discover that you can find how foods affect Alzheimer's disease, gallbladder disease, varicose veins, things that you never would have thought have anything to do with foods. It's all in the nutrition guide for clinicians. You don't have to get the book. It's a free download. Just go to nutrition guide for clinicians. It's there waiting for you. Okay. We have CME for doctors, dietitians, nurses, pharmacists at Nutrition CME, Continuing Medical Education. It's free. Our international conference on nutrition and medicine, this is where Dr. Daniel Ganu came last year. Let me invite you to come this year. It's August 10th, 2023. We'd love to have you here in Washington, D.C. We're going to have a blast, and we're going to look at the power of nutrition. One other quick resource. When patients are here at the Barnard Medical Center, as they leave our office, we ask them to take their phone and to shoot that QR code. In fact, you can take your phone now and you can hit that QR code right now if you'd like. And what that will do is that will bring you to foodinstructions.org. Or just go to that website, foodinstructions.org. What you will see there are short videos. Each video is a little cartoon. It just lasts a few minutes, but it's everything we've gone over today. And it's very, very simple and very engaging. So you can learn about how to counter insulin resistance, what foods you might want to choose. And we give this to our patients, but I share it with you too. This is my most recent book, Your Body in Balance. It talks about how foods can affect diabetes and every other hormonally related condition. I hope you get a chance to give it a try. Let me stop my screen share. And I just want to finish by saying that I am so grateful to the organizers of this conference for allowing me to share this time with you and for sharing the wonderful work that they have been doing. The practice of medicine is challenging. It's always challenging to tackle health conditions. And it gets somewhat more challenging when we get a little bit distracted by medications and other treatments that, while they are very important and sometimes necessary, are by no means all there is to health. We didn't get diabetes by having a metformin deficiency. We got there from an unhealthy diet for the most part. And if we improve our diet, we have tremendous power, not just for ourselves, but for the next generation. We learn a healthy diet, we pass it along to our kids, and maybe they will enjoy a health that was something that they otherwise would never have been able to enjoy, and they'll have you to thank. Thank you very much. Let me stop at that point. And if there are questions, I'd be more than happy to take them.
Okay.
So much. Thank you, Dr. Barnard. This is a real evidence-based presentation, and we are so grateful. This is so powerful. I believe our audience have questions. Definitely, we do have questions, lots of them, of course. And so I'm going to turn over to Marti right now to lead out in the questions and answer session.
All right, thank you. Thank you so much, Dr. Barnard. That was great. I tell you, you've been so generous in your time, and you're out there really just getting this information out time and time again. So we really appreciate that. I wanted to just kind of be in the minds of people that are on this symposium, because I know that one of the things that's confusing to people is we say that, you know, everybody thinks it's sugar, and you mentioned that. But the one thing that we talk about is that we want people to do a whole food plant-based diet. And with that is whole fruit. You mentioned in your presentation about low glycemic foods. You said no meats, very minimal oils, and low glycemic foods. When you think of whole fruit, do you think of low glycemic foods, or can you kind of reconcile that in people's minds that that is still important to do, to eat whole fruits?
Yes, fruit is terrific. Fruit is healthy. And people imagine that fruit is going to spike their blood sugar because it tastes very sweet. And if you are insulin resistant, if your cells are filled with fat, anything you eat that has glucose in it, whether it's fruit or the healthiest loaf of bread you can find at the store, or beans, the carbohydrate will cause your blood sugar to rise. But yes, you should be eating fruit. And when we test the glycemic index of fruit, it's actually quite low for most fruits. It's surprisingly low. So when we eat, and by the way, there should not be a limit on how much fruit you're going to eat. Eat the fruits that you want. Eat the beans that you want. Eat the whole grains that you want. Eat the vegetables that you want. And what you'll discover is your blood sugar might rise a little bit for the first day or 2 days or 3 days because you're still very insulin resistant. But what you will discover is that after about day 3, day 4, day 5, your blood sugar will start to come down. And if you're on medicine, make sure you check your blood sugar, because sometimes your blood sugar can come down. This diet is very powerful. Your blood sugar can fall very, very quickly. So be in touch with your physician and start backing off your medicine when the doctor says that you want to back off, so that you don't get too low. But fruit is fine. Fruit's low glycemic index, and you should be able to enjoy it.
Great. The other thing is how long have you seen it take for someone to actually reverse their diabetes? And the reason I want to ask that question is that there are a lot of people that eat meat on this symposium, I'm sure, and they love their meat. And sometimes it's like, it's not worth it for me to give that up. Now, so how long do you think it takes, though, to reverse it and to see results once you decide to go all in?
Well, the results start on day 1. What we discover is that when a person takes meat out of their diet, let's say it's Monday, and I take the meat out of my diet, and I'm going to say, I'm going to really give this a test. I take all the animal products out, I keep oils low. What you discover is that the weight loss, if you have excess weight, your weight starts to come down today. And over the next few days, you'll see it just starts to come down. Now, don't push it, because we're not going to be counting calories. You're going to eat as much as you normally want. Now, don't overdo it, but eat until you're full, and you'll discover that you'll be losing maybe about 0.5 kilogram per week. Something like that is about average. And so as time goes on, you're losing more and more weight, and your blood sugars will start coming down. The time course is different for each person, but for some people, their blood sugar comes down substantially within the very first couple of days. I'm not talking years, I'm talking days. For others, it might take a few weeks, but just see what happens and let it happen to you. Now, if you decide, I'm skeptical, I'm not sure that I really want to stop eating meat forever, do this as a test over a few weeks, and don't decide what you're going to eat forever at the moment. Just give it a try, because my goal is to see if I can cure you first. If after your diabetes is gone, you decide, well, I want to bring meat back, well, that's your choice at that time. But what most people choose to do is to stay with the diet that helped them to reclaim their health.
Okay, the last question, and I'm going to hand it over to Tamika, is that I know that there are these words we say out here in terms of vegan, whole food, plant-based. But do you see unhealthy vegans? And what does that really mean?
Well, a vegan diet simply means there's no animal products. And that's a really good choice. If a person eliminates animal products and they don't do any other change, that's a great thing they've done. They've made great progress. However, for many people, it's not just the meat and the dairy and the eggs that are in their diet that are not so hot. They might be eating candy, as I mentioned earlier. They might be eating a lot of potato chips and fried stuff that, even though it's not animal derived, is still not very healthy. And so that's why people often talk about more whole foods. So going vegan is a great thing. I don't mean to say it's bad. It's great. Getting away from animal products is super. But then you might want to look at the other things in your diet and see, how can I do things better? Can I really have foods made from beans and vegetables and fruits and whole grains? And what you'll discover is that there's a world of wonderful things for you to eat out there. And as you try different menus, different recipes, different restaurants, you'll have great successes. Once in a while, you'll find one that's not so hot. That's good. That means you're exploring. That means you're trying new things. But you'll find a world of choices out there, and you'll discover that your menu gets healthier and healthier and healthier, and you're never going to want to go back.
Awesome. Okay, Tamika, go ahead and fill the questions, please.
All right, we have several questions. The first one is, some people use honey in place of refined sugar. Is this healthy, and does honey help?
No, honey is basically sugar made by a bee. And so if a person is following a vegan diet, they wouldn't have it, because the bee is an animal too. That's the theoretical reason. But the practical reason is it's just sugar too.
Okay. Which vegetables and fruits have high glycemic index? Should we avoid such foods in our diets, even if we are not diabetic?
Okay, great question. Let me mention the sort of the hierarchy of rules. Avoiding the animal products, that's job one, because for many people, it's the dairy and the meat that are really causing their problems. So if a person gets away from animal products and they do nothing more than that, they've done a huge benefit for their health. They're also a good role model for their family. The second thing is, let's keep the oils low. Now you might say, well, there's a lot of oils that are kind of healthy, like the oils in peanut butter or olive oil. True enough, but you'll discover when you get away from the oils, weight loss is a whole lot faster. And then now let's tackle sort of the junk food part of it, or refining the different things. We're going to get rid of the candy and so forth. And within the vegetable category, some people will say, and correctly, that green leafy vegetables have a low glycemic index. That's true. Sweet potatoes, relatively low. White potatoes, somewhat higher. And so some people try to avoid the white potatoes. Others will say, actually, the glycemic index of a meal is the average of all the foods that went into it. So they might have a baked potato along with beans, along with vegetables, and the overall glycemic index is okay. So I think that actually makes some sense, is if you're having these foods in their natural state without a lot of butter and things added to them, that you can have pretty much the full range. Maybe a couple of exceptions here, though, I'm going to say. One is coconut, and the other is avocado. Avocados are delicious, but they are very high in fat. And so if right now is the time when you're trying to lose weight, and you're trying to tackle diabetes or high cholesterol, I would suggest avoiding the coconuts and avoiding the avocados for now.
Okay. Awesome. Is doing a vegan diet, if you find yourself at a roadblock, or she said, in doing a vegan diet, if you find yourself at a roadblock and decide to fast, will that deter the process or increase insulin resistance? She said, sometimes I'm not hungry and I'm sure that will change when I do this.
Did I understand right that the question is about what if I'm fasting for a while?
I think it's, if she finds herself at a roadblock and she decides to fast, will that deter the process or increase her insulin resistance?
If I'm understanding the question is about fasting, fasting is okay. For a short period of time to reduce the amount of food you eat is all right, but you don't need to do that. And I would encourage you not to do that for a long period of time. Unless you're doing it under medical supervision. Here's what I mean. There are some people who will fast a partial fast for a day or for 2 days. That's okay. And there are a lot of people who will eat a normal diet for 5 days and then they fast for a couple of days. The only negative there is that you start, if you've done this a few times, you start anticipating the fast. So on Thursday, we're eating extra because I know I'm not going to eat it very much on Friday. And then on Sunday, when I'm breaking the fast, I'm rebounding again, and then you're doing more harm than good. So don't do that. Now, the other thing is that some people with inflammatory diseases will go into a fasting center. Here in the United States, one is called True North, and they do a good job, but it's serious fasting, and you must be seen by a physician while you're under treatment, because to go for a long period of time without food can be risky. So fasting is okay, but if it's a prolonged fast, it's got to be under medical supervision.
Okay. Thank you.
Sure. Oh, and by the way, if you've hit a roadblock, if the roadblock means I was losing weight for a while, but I'm not losing weight anymore, what you should really do is write down everything you eat and look for fatty foods that might have sneaked in. If there are any animal products, take them out. If there is fatty foods like nuts, seeds, oils, or nut butters, keep in mind that fat gets into your cells too, and that slows down your insulin resistance. So you'll see the issue, and once you fix that, you'll get unstuck.
Great. So one question is, what is the best medication for diabetic patients?
Let me leave that between the patient and their doctor. The most common one is metformin, and many people start on that if they have type 2 diabetes. But let me leave that decision between you and your doctor, because an increasing number of doctors are saying, wait, stop. I just heard a nutrition lecture that said if we change our diet, we might see results fairly quickly. We might want to start there. So let me leave that between you and your caregiver.
Okay. And which age groups and gender are more susceptible to diabetes, and why?
Well, diabetes is something that can affect anybody. Now, we used to say it was more common over age 40, but today we see it in kids of 14. And it's not the genes that are changing, it's entirely their culture that's bringing unhealthy foods in. We used to say, well, we see it more common in women than men, but I have to say we see it very commonly in both men and women, and we see it in everybody. This is because we're eating fatty foods more and more, fat's getting into our muscle and liver cells, and our insulin is not working anymore. But you still have insulin in your body if you have type 2, and we can get it to work again.
Okay. Says at Subway, is the vegetarian sandwich okay with their type of bread?
If you go into Subway, they might say, have you tried our veggie patty? And if you say, well, what's in it? They'll say, well, it has some egg in it or some other animal products. I would suggest skipping that. You don't need that. Instead, say, take the bread, and it might be white bread or whatever, but that's okay. And say, put me all the vegetables in there. They'll fill it with lettuce, and they'll fill it with tomatoes, and they'll fill it with all kinds of foods. And then at the end, they'll say, do you want oil on it? You say, no, but flavor it with your nice red wine vinegar or something like that. There's no actual wine in it. It's just vinegar. And then they spritz it in there. And then if you want some jalapenos, you can say, make it not quite life-threatening for me. Put in a little spice in there. And then they'll wrap it up. And if you take a bottle of water instead of the soda that comes with it, you just got a healthy sandwich.
So this is a nice piggyback into that. They're asking, what impact does vinegar have in controlling glucose spikes before meals?
Some people will use vinegar hoping that it will have a hypoglycemic effect. I can't say that I have personally been very impressed by it. I think it really is a question of what the vinegar goes on. And if the vinegar goes on a salad that was made with cheese and chunks of ham and so forth, not so good. But if it went on your healthy, low-fat vegan salad, then you're in good shape.
Good stuff. Another question is, what do you recommend for patients that have problems digesting legumes and certain whole grains when transitioning to a plant-based diet?
Great. Beans are healthy foods, and their whole family: beans, peas, lentils, chickpeas. These are healthy foods. But if you're not used to eating them, I have 2 tips. One is cook them very thoroughly. If you're cooking them yourself, soak them overnight, get rid of the water. With fresh water, boil them until they are completely soft. They should not be al dente. They should not be crunchy. They've got to be soft. So make sure they're thoroughly cooked. If you bought a can of beans and you take them out and they taste like rocks, you got to get a different can of beans. They didn't cook them well at the factory. The second thing is, if you're not used to eating beans, start small, have a little bit, and as time goes on, you'll discover that your body adapts and you do better and better and better with them. And don't have only beans, have beans with rice or another grain. Now, if you're having issues with grains, wheat, barley, and rye are gluten-containing grains. 99% of people can digest gluten with no problem. 99% of people, but about 1% or a little bit less has celiac disease. They can't digest gluten. Not only that, I mean, they have a severe response to it that can be life-threatening. They can't have gluten, but everybody else can. So if you have a grain that you don't digest, well, you can skip it. But for most people, grains, particularly rice, are really, really good for digestion. And if a person has irritable bowel, bring the rice in, the cooked vegetables, and they're going to do fine.
One tip that I found was to add a strip of kombu as I'm cooking the beans. So I do like that long soak overnight, and then I add a strip of kombu, and that also really helps with the digestibility and the flatulency. Is there an issue with adding something like kombu to the mix?
Fine. No, that's fine. Just to be clear, would you let people know when you add it? Because we talked about soaking it. Do we add it there, or are we adding it when we cook?
I add it when I cook it. And just for you guys to know, kombu is a dried seaweed. It's a dry sea vegetable. So I add that strip of kombu as it's cooking, and then I remove it after it's done cooking. I don't.
That's perfectly fine. Exactly. You're not going to eat the kombu. It's there.
Yeah.
And many people will do that. And you don't need a huge amount. It doesn't have to be half kombu, half beans. You know, just that one strip will be helpful.
Just the one strip.
Yeah, yeah. Go ahead, give it a try. And there are other things. My friends in Mexico will use a spice called epazote, which is it's an old Mayan traditional spice that us gringos never heard of. But they use it for flavor, and it also has that same benefit.
I think I've seen that like in Trader Joe's or something like that. So
Yep. Exactly. It's kind of like, it's a little bit like parsley, sort of.
Okay. Then another question is, would a vegan low-fat diet make me lose too much weight?
Well, if you have that question, you're going to be the envy of all your friends. No, you're not going to lose too much weight. What will happen is that what you're losing is not muscle, and your skin is not getting thinner. What's happening is your fat layer is diminishing, and so it's going to diminish until you hit more or less what nature had in mind for you.
Awesome. What advice would you give with cooked veggies and fruit?
You mean, can you eat them together? Yeah, I think you can eat them together. What a lot of people will do, though, this is entirely up to you. The fruit is sometimes the dessert. Let's say you've had your beans and you've had your rice and your spices and all these kind of savory things. When the meal is drawing to a close, that's a time where instead of pudding or jello or ice cream, forget that stuff. That's what caused the problem in the first place. What you do is you take out your mango and your blueberries and your sliced bananas, and you just serve that to your guests. And what they say is, what a delicate, sweet flavor these fruits have. And after the meal, everyone's your best friend.
Awesome. Now, how often should one eat, or should one with diabetes eat, and how much should one eat?
Through the process of what we call homeostasis, your brain is keeping track of what you eat, and it will stop you naturally. If your foods are natural foods that are high in fiber and very low in fat, your body will tell you when to stop. Now, some people will say stop when you're full. Remember when you were a kid? Remember when you were 6 or 7? You were really hungry before lunch, And then at lunch, you got full, and then you want to go out and do other things. You didn't sit there and just keep eating. You said, I'm full, I'm stopping. Now in adulthood, a lot of us don't ever get hungry because we've always got something in a drawer to munch on. And we don't stop eating when we're full because we didn't have anything very interesting to do after dinner. Well, it's good to pay attention to those cues that we had before and let them guide us when to start and when to stop.
Awesome.
Oh, I didn't answer your question about how often should you eat. Typical in many countries, people eat 3 times a day. That's fine. A number of researchers tried using frequent small meals to see if that was helpful. It probably is not especially helpful. And then other people have been using fewer meals, 1 meal a day or 2 meals a day. And many people have found some benefit from doing that as well. But you can do it really in any way that works for you. I don't think you need to force yourself into one or another of these patterns. You could try them out if you want. But many people do just fine with 3 meals a day.
Okay.
I think I wanted to piggyback on that one thing, excuse me.
Yes.
We were talking about protein, and I noticed that someone did ask a question about, can you still have strength and feel strong with no meat? But I wanted to mention that only because there's this thought that one is, I'm going to lose weight. Number 2 is, I'm not going to have energy. And number 3 is, I'm not going to feel strong. I'm not going to get enough protein. I know you mentioned that in your presentation, Dr. Barnard, but maybe if you could just emphasize that, about the protein, again, about feeling strong and things like that.
Okay. First of all, a couple of things. Thank you, Marty, for asking that, because it's a really important question. Our view on protein has completely changed. Back in the 1950s, we had this naive idea that meat was complete protein and healthier protein, or dairy protein or egg protein. And what they meant is a protein molecule is actually a string of beads. If you looked at it under a powerful microscope, each bead is an amino acid. And those amino acid building blocks make protein. And some of them we can't make. So they're called essential amino acids because plants make them, and we need to eat the plants to get the essential amino acids. Now, if you eat eggs or meat, they've got a lot of those essential amino acids. Plants made them, and then the animal concentrated them in their meat or their muscle tissue or in the egg. And so back in the 1950s, people thought, well, animal products must be superior because they're very high in the essential amino acids. But in 2016, researchers at Harvard asked the question, if meat protein is so superior, what's the health benefit from that? And they did a study looking at a very large group of men and women, and what they found is that there is no advantage to animal protein. In fact, people who eat more animal protein from meat, from eggs, from fish, from dairy are more likely to die younger than people who got all their protein from plants. And they showed if you could swap egg protein or fish protein, instead have plant protein, people would tend to live longer. Now, let me go back to what you're raising about athletes. About 20 years ago or so, distance runners started to notice that their energy was better if they would be on a vegan diet, if they would avoid animal products completely. And the reason they seemed to think was, well, 2 things. Plants have carbohydrate that fuels your muscles. Carbohydrate is what gets into your liver, builds glycogen, and that's your batteries. That's what gives you energy. But the other thing is that meat and dairy products have fat, and fat makes your blood slower to circulate. It makes it more viscous, and that slows down your athletics. So distance runners like Scott Jurek all started going vegan, and they were the best runners there were. And in Mexico, the Tarahumara tribe really showed that these huge, long 50-mile runs, they were the best runners of all, and they were eating beans and corn, basically. So then the tennis players started to use vegan diets. And I credit Venus Williams for doing this because she had an autoimmune condition called Sjogren's disease, and her career tanked. And so she went on a vegan diet, especially the no dairy, no meat, and she got her career back and got her strength back. So her sister Serena said, well, if you're doing it, I'm going to do it too. And then on the other side of the net, Novak Djokovic said, well, let me try this out. And Novak Djokovic went vegan, and he's the #1 tennis player. And he started a vegan restaurant. And then the people in power sports, to be a tennis player, you have to be strong and fast. And football players started to do it, and power lifters started to do it. And now we believe that the best protein is plant protein. You don't have to increase the amount you eat if you wish to. If you're using supplemental protein, it should be plant-based. But to get through the normal sports that most of us are doing, to get through day-to-day life, and for growing children, you do not need animal protein. All you do need is a variety of foods from plants, beans and vegetables and grains, and you're going to get all the protein that you need.
Awesome.
Dr. Barnard, we lost your video, or Dr. Barnard. we
I lost your video.
Yeah, you're not
Oh.
on video anymore.
Oh, sorry.
Okay,
There I
awesome.
am.
So one of the things, since we have an audience that's in Africa as well as the United States, one of the things that I would like for you to address is there was a question of, hey, this sounds great, but a lot of the foods that you've mentioned, we don't have here in Africa. What would you recommend? Or,
Okay, that's a terrific question. I would say two things. One is we need variety. There are some places where due to difficulty in distribution, economics, civil strife, and other reasons have very limited foods. And so if you're eating nothing but a starchy vegetable all day long, and you don't have any other leafy vegetables, and you don't have any beans or any pulses, that's not an adequate diet. So there are really four groups that people should be focusing on: vegetables, fruits, whole grains, and I'm saying beans. But you know what? Here in the United States, people are used to baked beans, which are navy beans. And when I go over to Italy, people say, well, wait a minute, I eat chickpeas. That's what I want, or I want lentils. And my friends down in Cancun say, forget all that stuff. I have black beans. That's what I want. And my friends in Montgomery, Alabama say, haven't you ever tasted black-eyed peas? Anyway, there are a million kinds of beans and peas and lentils. Those are very nutritious, high in calcium, high in iron, high in protein. Bring them into your diet, and they're cheap. You want grains to go with it. Now, here in the United States, people wouldn't know a grain unless it was a hamburger bun, and that's from wheat. Wheat is fine, but it can be whole wheat. Or we have corn, and of course we feed corn to cows. Well, if we ate the corn ourselves, that would be fine. And I got to tell you, the corn is something that is indigenous to North America, to Central America, and it's a delicious whole grain. But you might have quinoa as your grain, or you might have many other kinds of grains. Rice is a terrific grain. Keep it whole grain like brown rice, it's always better. If you don't have brown rice, the white rice is okay, but it's better to have the whole grains if you can.
all right, great. So Tamika, you can go ahead and ask other questions. Okay.
I think Dr. Ganu wanted to.
Yes, I think my question was rightly asked by Marti. We should have alerted Dr. Barnard earlier on that you are speaking to a whole group of Africans in this conference, and the setting of most of the countries in Africa is such that there aren't varieties and availability of foods. Would you recommend a vegan diet for such people? Talk about people in the Sahara region, where even vegetables are very expensive because of the climate over there. What do we do with such people? Could they be practicing plant-based diet to their detriment?
A plant-based diet is good for everyone and is important for everyone, because in sub-Saharan Africa, just like the rest of the world, we are starting to see that there are changes in our health that come from dietary changes. Now, the changes are going in two directions. There are sometimes when a lack of availability of food in certain areas means that people are not doing very well. But those foods, sometimes people will say, well, let's put meat in. Let's give people a goat to eat, or let's give people animals so they can eat chickens and so forth. In my view, that's a mistake for a couple of reasons. The first is you have to feed the animals. Secondly, what you're getting is cholesterol, and you're not getting the foods that we really need. What we should do instead is try to do what we can politically to improve food distribution wherever people may be. They don't have to be expensive foods. They can be inexpensive and simple foods, the vegetables and the fruits and the whole grains and the beans, so that we have those four foods represented. Now, the other change, though, in the other direction is when people are westernizing their diets and bringing in lots of meat and dairy products and so forth, we are starting to see diabetes and cardiovascular disease. Now, there are, of course, parts of Africa where vegan eating has been a tradition since for a very long time. Our friends in Ethiopia, they won't use the word vegan, but they'll say on Tuesday, I don't eat any animal products. I'm going to do that later in the week too. And during Lent, I am more than happy to skip meat entirely. And you say, are you vegan? They'll say, I don't know what you're talking about. I don't eat that way, but I'm just not going to eat the animal products. Now, here in Washington, D.C., we have taken advantage of that because my many Ethiopian friends have shown me the treasures that are simple and inexpensive things made from lentils and split peas and hot peppers and many things, but turn out to be wonderful culinary treasures. So when diets are not healthy, the answer is to make these healthful foods available wherever they may be.
And
Thank
Dr.
you.
Barnard, Dr. Ganu, let me ask you, both of you all, I know that, food addiction is an issue. The fact that there's things really going on physiologically with our brains based on the things that they're putting in their food. I think a lot of this is being exported over into Africa. And so therefore the pharmaceuticals are going over into Africa.
Mm.
And so it's more of a statement. I think it's like, how do we go about really, one, getting the information out there, but also combating this rush to get the pharmacological kind of treatments over there as opposed to nutritional treatments. And that's why this symposium is so important.
Good.
Dr. Ganu, maybe you would like to tackle that question first. I have a few comments that I'd be happy to make, but let me give you the floor first if you would like.
Yeah, thank you. Yes, there is no question about the pharmaceutical companies taking advantage of the situation, especially back home in Africa. The issue is ignorance plays a lot also. You know, there are many of us here in the continent that are very ignorant, not even some learned people are very ignorant of the fact that meat, food, and saturated fat are very detrimental to our body. And so it's all about the mind and the education, the education that we are having now. But my concern actually is that when you go to some African countries, vegetables are, they are not there. They are not there. Even if they are there, they are extremely expensive. And so my question was, could it be possible? How do we go about recommending plant-based diets to those people? Talk about a country like Burkina Faso in the Sahara Desert, Mali, and those countries where the poor people find it very difficult even to buy tomatoes. How do we go about recommend? And these are the people we talk to. These are the people, and of course, some of these diseases know no boundary, whether you are poor or not. And so those are my concerns.
It's a terrific question that you have posed, and food distribution is changing dramatically. Keep in mind the tomato didn't come from Africa. The tomato is actually a North American food, as along with peanuts and potatoes and some other things that are North American, but they've started to go elsewhere. And there are many foods that are African foods that have now become part of North American cuisine. Over the past 500, 600 years, there has been these exchanges so that different foods are being distributed all over the place. And in many cases, it is not a question of anything other than governmental policies. Sometimes political situations are such that food distribution is rendered very, very difficult. So we do the best we can with these things. What I'm trying to promote is an awareness of what is good for the human body. There are so-called charities that are rounding up chickens or goats or rabbits and sending them out into poor countries, saying that you should have these animals and raise them, and this will give you food. But they're often creating many more problems than they're solving. And I really think that we need to deal with those. Now, that doesn't mean that I have the answer to civil strife in these countries, but what we do have is a clear sense of what the human body requires for good health. And that's foods that are derived from plants. And we also have very clear evidence of the things that compromise our health, unfortunately. And those are the animal products. Now, let me say something about this. My father grew up on a livestock farm. That was his business because his father was a cattle farmer. These were good people and they meant well. But as time went on and we started to do our research, we discovered that in the same way as tobacco farmers who were honest people were causing problems for other people, the same is true with people in my family and others who were raising these products and selling them. But we can now put our knowledge to work and we can see what we can do to change things. Good.
Awesome. So I have a couple of more questions that are around this food topic of the types of food that would qualify for the diet. So one person asked, does maize qualify to be called as a whole grain?
Absolutely. Maize is a more sophisticated word for corn, and it's perfectly healthy. Okay.
And another person asked, is ground nut a healthy snack?
Are you saying nuts?
Yeah, ground nuts.
Well, nuts have an advantage. They're plants, so they don't have cholesterol, and they don't have much saturated fat. However, nuts have quite a lot of fat. It's a healthier type of fat, but there's a fair amount in it. So if you're trying to lose weight or trying to reverse diabetes, I would keep nuts to a minimum too. Keep in mind, when the nut was in the tree, it was surrounded by a shell, and it took some time to get it out. Nowadays, you can go in the United States, you can go into any convenience store and you can buy nuts that have been removed from the shell, salted and fried and put in a little pack, and you can eat a whole lot of those really quickly. So you want to be very careful about that. Okay.
Are there ethical considerations for Adventist institutions with mixed students, especially in implementing a plant-based diet?
Well, there are, of course, ethical. I'm not sure which direction this is going, but I'll just tell you. There are, of course, ethical issues with regard to food choices. The first obvious one is that everybody by now knows that our climate is changing. And all you have to do is to go back to North Dakota, where I was raised, and you can look at each cow busily belching methane into the atmosphere. Methane is a very powerful greenhouse gas. And so the more people are eating meat, the more they are fueling climate change, and that's a serious ethical problem. People who have a heart for animals are going to be the first ones to give up meat because the animals going into the slaughterhouse don't have a very nice experience. They also are quick to give up dairy because people who haven't been on a dairy farm don't realize how you get a glass of milk, but what you do is you have to artificially inseminate the females, which they are not particularly grateful to you for doing. 9 months later, they are going to give birth, and when their calf is born, the calf is removed from them. There's no bond in nature stronger than that between a mother and her baby, but this dairy cow who you impregnated is going to lose her baby, and the baby is a male, and he will be slaughtered for veal. Now, a lot of civilized people say, well, that's pretty creepy. I don't want to do that. But what they do to the females is worse. They raise her in isolation, feeding her milk replacer instead of letting her be with her mother. And when she's about a year old, they will impregnate her and take her offspring away. And cows in nature live to be about age 20. On dairy farms, they live to be about 4 because they're not producing enough milk to justify their continued existence. And at that point, they're hung up by the leg and their throats are slit and they turn into low-grade hamburger. So the reason I could speak about all of these things is because our family was involved in all of this stuff. And it's all things that we assumed were sort of normal and fine. But in the same way as civilization grows and we look for things that we can do that are less harmful, let's face it, our civilization has done a lot of harmful things to each other, to the world that we live in. And if we have a chance to maybe show a bit of compassion to other people, maybe people that we didn't grow up with or never knew before, to animals or to the world that we're living in. We are not only doing something better for them, we're doing something better for ourselves. And most of all, we're role modeling compassion for our children. And let's face it, children face all kinds of threats. If they can learn how to be compassionate toward their friends, toward the animals, toward the earth, and toward their own coronary arteries, that's going to be a better thing.
Wow. Okay, so I think this, I don't know if this is the final one, but we'll see. There might be some in the chat. While we agree animal food is bad, does taking out blood and fats in halal food make them better? And what about white meat versus red meat?
White meat is really not dramatically better than red meat, I'm sorry to say. Chicken is modestly lower in fat when you remove the skin, but it still has no fiber. It doesn't have any complex carbohydrate and has a substantial amount of saturated fat. My Muslim friends will tell me that when they look at the health risks that are occurring in their own community, they're similar to other communities, whether the food is halal or not. And so what we recommend is that people follow a vegan diet regardless of whatever culture they're following. And you can do this regardless of your religious faith. People can choose to eat plant foods, and a great many people are doing that regardless of their cultural traditions.
Wow. Awesome, awesome, awesome. We thank you so much for the answer to these questions. Marty, do we have any more?
I do. I want to mention a couple of things. One is, marketing, and this is a question from one of the members, but I think it's very important. Marketing is so pervasive. And of course, like you mentioned, our decisions don't come from logic. It comes from all this information coming at us, and it kind of becomes a part of our spirit, I think, to where we feel that we need these things. So many products are popping up with plant-based labels. That's another thing, and vegan labels that when you now really read on the back, have a whole lot of crap in it. What are your thoughts on that?
Yes, there are certain foods that happen to be addicting. And many people, the reason I emphasize this is many people blame themselves. They'll say, I don't have much willpower, or I had a bad upbringing, or whatever. Forget it. That's not you. It's the food itself is addicting to you. And I'll give you two examples. The first is with sugary foods. Sugar is something, there are traces of natural sugar in an apple, but it's not really very much. But when people learn that you can raise sugar cane and send it into a factory and remove all the fiber and concentrate the sucrose, and especially if you mix sucrose with fat, which is what happens in a candy bar or a donut, it's sugar and it's fat mixed together. That stimulates the addictive parts of the brain much more than pure sugar. The second one is cheese. Now, this may sound funny, but a lot of people discover that they can't give up cheese. And the reason is that in the dairy protein are what are called casomorphins. Casein is the milk protein. In your digestive tract, it breaks apart to release casomorphins, which are compounds in dairy protein that go to the brain and attach to the same receptor that narcotics attach to. When milk is turned into cheese, the casein is concentrated, so cheese is more addictive than milk or ice cream. So when a person breaks away from meat and so forth, they're going to say, well, but I still want sugar and I still want cheese on my pizza. And now you know the reason why.
Wow.
I think I missed a question, so I want to ask that. Which fruits are best for persons with ulcers? They said they have a challenge eating citrus.
Oh, okay. Generally speaking, pretty much the whole cornucopia of fruits are fine. But if you find one that doesn't agree with you, you can avoid it. And so the citrus fruits are generally fine for people, but you can avoid them if you want to. But if you have an ulcer, I'm talking about if you have peptic ulcer disease, I would encourage you to see your physician, because you may have something that has nothing to do with diet at all. About 20 or 30 years ago, researchers discovered that Helicobacter pylori infects the stomach lining and causes ulcers to form. And it's just like an infection anywhere else. In the same way as if you have a lung infection, an antibiotic will knock that out and you're going to be fine. Antibiotics can also knock out Helicobacter pylori and get rid of your ulcers. So talk to your doctor and see if you might not need an antibiotic.
Okay, and then I think there's one more. How would I know that I have diabetes?
You know, it's a great question. Many people have no idea that they have diabetes. Now,
Mhm.
in a classic textbook, they'll say, well, diabetes means that the sugar is not getting out of your blood into your muscles. So one symptom is that you're tired because the sugar isn't fueling your muscles. Another symptom is that you're thirsty all the time because the sugar in your blood is going through your kidneys into your urine, and it's carrying water out. So you're urinating more, and that makes you thirsty. But you may have diabetes without having any of those symptoms. Your energy might be normal. You're not urinating more, and you're not especially thirsty. So the way most people find out is they go to the doctor who does a blood test and just looks at their blood sugar. And if their blood sugar is elevated, that's what it is. If you have diabetes, though, let me encourage you to see this as a sign that we want to change our diet and get on as healthy a diet as we can and see how we do. If your doctor says you're going to need medicine, take your doctor's advice, and your doctor needs to figure out what kind of diabetes you have. If it's type 1, that means that your pancreatic cells are not producing insulin very well anymore, and you will then need to take insulin externally, and that's going to be essential for you at that point. But your doctor can advise you on all of those things.
Very good.
Awesome. And in the discussion that we've been having about food distribution, one of the participants is from Southern Africa, and they said that they do have vegetables in that area that they're in. They're in Botswana, and they did say it's largely desert. But one of the things that they found helpful is for people to actually plant gardens in their backyard. So this is all, part of just that discussion about how we can improve the food distribution, for plant-based foods so that people are getting those healthy foods.
And Tamika, and I think that Dr. Ganu, this is where I think your center is going to be very instrumental. It's being able to come together with your community, and then the community extends itself to where people start to think creatively and recognize what Dr. Barnard says is that, okay, it may not be that convenient, but it's very necessary. So now with that, how do we go about giving our bodies what it needs, regardless? Not easy.
Yes, and it has to do more of education, drawing people's awareness. Yes, the vegetables might be there, but people might think that they are expensive, or some might think that they don't have the money. But then what we actually need is educating people, like we are doing right now, to let them know that prevention is better than cure.
Very good.
Yeah.
Absolutely.
Okay. I think we have come to the end. Tamika, do we have something else? Any question? No?
No, the only other question that I saw was someone asking, is there a specific fruit for a diabetic person? And I think that Dr. Barnard has, been talking about the different fruits and vegetables that we can eat for diabetes or just healthy lifestyle. And so I think he's actually covered that in some of his other answers. So I think we're good.
Thank you.
Dr. Barnard, one thing though, we're talking about all this. You're out there in the trenches. The increase in diabetes, it's been an increase around the world. Are we making progress?
We're seeing changes. Great question. We're seeing changes in two directions. First of all, the number of people who are interested in healthy eating is bigger than it ever was before. The number of caregivers who are using this approach is bigger than it has ever been before. That's great. And the number of people who are teaching this in schools and reforming hospital food, that's a bigger number than ever before. But we have to also face the challenge that there is also a huge number of people who are really at risk. And we see this really throughout the world, particularly when economics changes and maybe people can afford to eat American food or something like that. It's not necessarily a good thing, unfortunately. So we're seeing changes in both directions. But I want to thank all of you for organizing this, because what you're doing is you're giving people the power of knowledge that we can really increase the momentum of health. So let me thank you so much for what you've done. Thank you for letting me be a small part of this program.
And we thank you, Dr. Barnard, for spending your time with us. We know you are a very busy person, but you responded to our call. And you have been with us for 1.5 hours, and you have given us great stuff. I'm going to ask the audience to show our appreciations by our electronic hand, thumb up, love, and Dr. Barnard, you see those flying? And that is a way to say that thank you so much for what you have given us. And we appreciate you. This will not be the end. Some people have recommended that we should have these once every year. And if we need you, we will come to you again, and we know you will never say no. Would you say yes? We would like to get that affirmation from you.
Count me in. Thank you so much. Thank you very much. It's been fun talking with you, and I really appreciate the opportunity. Thank you so much. I look forward to talking with you more. By the way, good luck with all the wonderful things you're doing. I am so excited about your plans and everything that you're doing. Thank you so much.
Thank you.
Thank you. Back to you, Marti.
Okay, all righty. Well, that was powerful.